The Human Sciences Research Council is calling on South Africans to participate in the 6th National HIV and Health Study. It helps to illustrate what drives the HIV pandemic, determines its prevalence, as well as access to antiretroviral medication. Once the survey is done, public health policies and programs are then designed. But there is a deadline of 3 months if you would like to participate. To help us understand this further, we are joined now by Adlai Davids, who is from the Human Sciences Research Council. Adlai, thank you so much for your time this morning. Very good morning to you. Let's talk a little bit about, number one, this study. For those of us that are hearing about it for the first time, what does it seek to do and what exactly do you need from South Africans?
Well, good morning. As you said in your introduction, this kind of survey is required for us to formulate HIV policy in the country, as well as a focus on COVID and other diseases. We've been designing this study or running this study for the last 20 years or more. It was first done in 2002, and then former President Nelson Mandela was pivotal in starting off of this study. And this current version is the 6th wave of the study. So the study, we aim at getting to about 93,000 people in about 25,000 households. And at the moment, we're about 70% there. And that is why we have this last final push for the next 3 months to try and just wrap it up, especially in suburban areas, because we've done well in farming areas, in rural areas, urban informal areas, as well as farms. So our final push is in about 4 provinces in suburban areas where we're struggling to get people to participate. And as a national study, we really would like to have a complete cross-section of all households represented in our survey to be able to put together this evidence-based policy making that the HSRC strives to do.
Well, Adlai, as you're speaking about how you're struggling to reach suburban areas, the suburbs basically, in that instance, does that not speak a lot to stigma that still exists regarding HIV transmission and who gets it? Whereas a lot of times, HIV is almost seen as the disease of those that are poor, right? The disadvantaged communities, the outcast communities, that those that are CEO, managing directors, the people that you would find in the suburban areas, right? The CEOs, C-suite executives, the managing directors, that they are not even touched by HIV, that it can't get to them, that it's only reserved for the majority who live in poverty, as well as perhaps more disadvantaged backgrounds. And maybe that's why the high walls keep all of that information away, or at least still allow the stigma to perpetuate around who actually gets infected by HIV.
Well, we might have maybe that as an explanation, but I think our experience is more practical in the sense that you might find that the people in these suburban areas most probably are either not at home during the day, where they might be at work, and even if those who are working from home might not have the time to do that, or basically there is that trust deficit about who you would allow on your property to investigate. So it could be fueled by stigma, but we have found that all communities and all so-called lifestyle segmentations are impacted by the disease. And we're also doing work around COVID, so necessarily we need to speak about that also. Stigma is a very difficult one to talk to. It may drive that, but our main problem is that of access. And yet we try to do community entry as best as possible. We try to minimize the risk of being rejected in terms of access, because sometimes we do find people do participate when they just get adequate information and it is practical for them to participate. So, for example, we would love to, if people are working, maybe find a time in the day whereby we can be less disruptive, like we had in cases where farmers would allow us and farm managers to make sure that when production is has a lull, then they allow make a plan around that. So it's practical arrangements. So that is why we're trying to get hold of it, because genuinely we would love to have this cross segment. And whatever the impediments, we'd really like to talk about it, because when we do community entry, we talk to neighborhood watchers, we talk to security companies, we go to ward councillors, we try to make ourselves known on the local social media groups, etc., etc. So we would love to push in those 4 provinces: Gauteng, the Western Cape, KZN, and also, in fact, here in the Eastern Cape, in my hometown, Tebega, to be able to push into some of those selected areas. There's really no all research is done through consent, because that is what the research ethics require of us to do, and so on. But yeah, we could speculate, but at the moment, our main issue is that of access to the households that were pre-selected, not all households, pre-selected households.
Yeah, access means that there must also be a trust. And if they won't allow you access, that means that there is no trust. So then how do we break through the barriers, so as it were? And I go back to the issue around how a lot of the suburbs have got high walls, so how do you break through that so that you can get on the other side of trust and actually have people authentically so share their insights from a place of having to understand better?
Yeah, it is a difficult one. The best we can do is to have opportunities like this to communicate why it's so important that we have an adequate profile of HIV, both in terms of its prevalence and its incidence, and also for finding out for people who are ARVs whether there is viral suppression, and whether or not we don't have viral resistance or antiretroviral drug resistance in people who are on treatment. So we come from a place where we'd like to be. We are, as a credible organization, we're trustworthy, and we try to talk to people on the basis. We make sure that our data collectors are well identified. There is numbers to phone if people are unsure about whether they can trust this person that is knocking on their door, to say who they are. They are well identified, as I said. They have ID cards. The cars they drive are branded, and often we put that on the community social groups, social media groups, so that we can identify the car registration, the names of the team supervisor, the logo that's emblazoned on the bibs that they are wearing. And in that sense, we try from our side to be as open as possible, to be announce ourselves well in advance, so that there's so from the practical side, people would be able to allow us in. And we do get that in a lesser, but for suburban areas, this is actually where they are, because HIV and COVID, which we're also looking at, affects everyone.
We're going to have to leave it here. Adlai, much appreciated for your time this morning. Adlai Davids from the Human Sciences Research Council.